So, as I mentioned, I'm going to walk you through a few things. First of all, just to get you familiarized with the health system in Malaysia. And then I'll go through some of the specific area of services where refugees will be entitled for either free or highly subsidized care, as well as include probably to walk you through and point to you where you can get information about NGO health services as well. So first of all, in terms of health system in Malaysia, Malaysia practice a two-tier healthcare system. We have the public or government-run service health facilities, which probably you are familiar with, which is known as the Klinik Kesihatan, which is the health clinics or the government hospital. We also have services provided by the private entity. So this can be any nearby GP clinic or in and around your neighborhood, or it could be a private hospital, for example, like some of the big names like Sunway, Pantai, and etc. Unfortunately, both require out-of-pocket payments for refugees. But for government facilities, UNHCR card holder or document holder are eligible for 50% charge off the foreigner's rate. So whatever that is being charged will be half if you are a UNHCR document holder. And this is actually covered by one of the Ministry of Health circular, which I have cited here on the fourth bullet point. If at all needed, all these circular that I shared today are also available at the Refugee Malaysia website. As I mentioned, there are also alternative services provided by NGO partners for refugees, which is almost free or at a very minimal charges. So you can access some of these services as well if needed. Also going to just break it down for you a bit more to differentiate like in terms of like what do we mean by primary, secondary, and tertiary care. So for primary care, basically these are the essential treatment, usually for acute illnesses as a first point of care, which is very important to highlight here, where these health facilities usually is in the form of, it could be any government health clinics or the emergency department, outpatient department at the district hospital, where they provide basic services. They ensure that you get the first care as needed, and if at all needed, and they deem that this is beyond the basic medical intervention and there's a need for referral, that's when you'll be referred to the secondary or the tertiary facilities. So for secondary, basically, these are what we call as the specialist treatment and care services, where a specialist will attend to you for a very specific disease or condition. For example, if let's say you have a heart condition or heart problems, usually the first doctor will then refer you to see a cardiologist, which is a heart doctor, a heart specialist, to attend to your needs. And if there's a need for further care, for example, or very specialized care, then they will refer you to tertiary facilities, which usually will require very specialized equipment or expertise and will involve complex treatment procedures. So all in all, I think most of the time, whenever you have some condition, for example, there's the first presentation of signs and symptoms, where you should go to is basically the primary health facilities. So this could be in the form of a Klinik Kesihatan, private GPs, or emergency department of district hospitals, where you can get the first care, and then eventually the doctors will do the necessary to refer you onwards if needed for further care. So this is actually a decision that will be taken by the medical professionals then. So I think your first contact will be always the primary facilities. And our NGO partners are also providing primary healthcare services. And I'll point to you later where you can get some of these key services as well. Right? So in terms of health services, where, you know, more specific to certain age group or condition, I would just like to break it down this way so that it's easier for you to understand. As I mentioned, primary healthcare would be the number one most important point of first entry point to the health system, where you can actually access either through the government health facilities, either in the Klinik Kesihatan or outpatient hospital side, or it could be a private clinic for example, or NGO partners. Okay, so this will be the first point of care that you can actually go to. And then other specified services, for example, on vaccination, on reproductive health, on HIV, on mental health. These are some of the key services that I would like to highlight today as well. So as I move on, all right. So for primary health services, right, as I mentioned, the government health facilities are the one that you can actually go to. Currently, I think for every 5 kilometer from the center of a district or a town, there will be one government health facilities nearby. So this is highly accessible, especially for rural area. And for all UNHCR document holder, you are actually entitled for 50% off the foreigners' charges. Yes, to a certain extent, I think affordability remains a challenge for many refugees. There are also these private GP or the private clinics that you might be familiar with. And most of the time, you can find these clinics scattered everywhere. So it could be any shop lot that runs a clinic, usually operated by private entity. And specifically for these three partners that I mentioned here, Qualitas, Care Clinic, and Health Hub, these are private partners that UNHCR currently had a collaboration with, where they agreed to provide highly subsidized care for refugees. So you can pay like cheaper than what the usual charges would be to get a consultation done and to get the required medication and some procedures done as well. So as I mentioned, there are currently about 76 Qualitas clinic scattered around the peninsula of Malaysia, where you can actually go to. And we actually shared the list in the Refugee Malaysia website as well. And most of this information I'm sharing today also available in the Refugee Malaysia website. And same goes to the Care Clinic and also the Health Hubs. Health Hubs are actually our new partners. And for some of you who have attended the previous webinar, Dr. Rachel has actually shared about their services offered by Health Hubs. So they currently have 3 private clinics offering services to refugees at the cost of 10 ringgit. Okay, for Qualitas and Care Clinic, the charges varies, but for general consultation and plus medication is around 50 ringgit. Okay, so as I mentioned, payment still required, and most of the time, based on our survey, it seems like many of you are not really aware of these private GPs offering subsidized care. So I think today will be a good opportunity for me to do a bit of a publicity, as well as to encourage you to approach some of these private clinics if needed, and do provide some feedbacks to us as well, and what your user experience like at when accessing some of these clinics, okay, in the near future. For NGO clinics, currently there are 12 clinics known to UNHCR and currently our partner as well. So they are providing alternative and affordable primary healthcare services for refugees. I'm going to show you a map now. This is where the clinics are located. As you can see, we have quite a number of them located in the central region. And if you look at this map, right, what it means is that the darker color, the darker tone of blue means that the high concentration of refugees and asylum seekers. Okay, as you can see, the central region within the Klang Valley, and then the northern region, Penang and Kedah, as well as Johor down south, are some of the regions that with a higher number of refugees and asylum seekers. So in Penang, we have Doctors Without Borders, MSF, located in Butterworth. We also have a partner, Malaysian Relief Agency, operating a clinic there in Sungai Petani, Kedah. So these are actually funded by Qatar Fund for Development. And in the central region, of course, the familiar one will be Suci Foundation, the clinic QFFD Imarat at the Selayang, and then you have Mercy Malaysia's clinic at Ampang and also Kajang, and Amal Muhajir is Seri Kembangan. So we also have our True Global Clinic which is another NGO partner, providing services at Subang Jaya. And of course, we have ACTS in Brickfields, and the new partners, Health Hubs, running 3 clinics, which is a Health Junction Clinic, Clinic S.N. Lee, HBM Family Clinic, which is located in the KL City Centre, and then Sri Kembangan as well as Damansara. So in other locations, especially on the East Coast, unfortunately, we do not have a strong presence of NGO partners in this location like Kelantan, Terengganu, Pahang, where we are still relying on mobile outreach. So from time to time, partners like Malaysian Relief Agency, IMARET, Suchi Foundation might conduct a mobile clinic outreach to some of these locations. So in general, I think the go-to for refugees and asylum seekers living in these states would be to the government health facilities or to the nearby private GP for acute care. Okay, I hope this is clear. And if you need more information about the location, the operating hours, and the specific services provided by these partners, you can actually go to the Refugee Malaysia website. Please feel free to browse through the website from time to time as we provide updates, as well as you can get to keep some of this information handy with you in case you need it, and at least you know where you can actually get these services from. Okay. So just to highlight that the following services are the ones that are also provided by NGO partners, like for example, child vaccination, antenatal care, family planning services like contraceptive, and dental care is currently by Suchi Foundation as well as a Clinic Amal Muhajir, physiotherapy, and mental health services by some of the partners. Again, I highly encourage you to go to the Refugee Malaysia website to look for all this information, and feel free to share it among your community and spread the words around so that people are aware of services provided by some of the NGO partners. Again, before I move on to the next slide, just to reiterate that services provided by the NGO partners are not the main one. So basically, the government health clinics are still providing most of the services, and we also know that most refugees also go to private GP near their places to access care. So the NGO partners are actually providing as an alternative in case especially for some of you who might have some difficulties, for example, financially couldn't afford anything, then at least there's this safety net of NGO partners around to help you. Okay. Firstly, on child vaccination, I just like to make a point here, which is very important, which is to make sure that your child is fully vaccinated as per the national schedule. Actually, I put a picture here of the national immunization schedule. Basically, there are a list of vaccines that are required to be taken for all children living in Malaysia. First, of course, you start off with BCG and hepatitis B, which is given at birth. So this is actually done if your baby is delivered in the government health hospitals, or even in private or maternity centers. They will also do the same, because this is mandated by the Ministry of Health. And then the next vaccine to get is the 6-in-1, which is the Hexacin, the hexavalent vaccine, which is since 2022, Hexacin has been provided for free by all government health facilities. So basically, you can actually walk in with or without your UNHCR document to get Hexacin for free. Okay, the important thing is to make sure that you have your childhood vaccination record book with you when you are seeking for the vaccine. So at times, we do note that some of you might have difficulties or challenges accessing this, but if at all, you can always check back on this Ministry of Health circular, which we also publish in the Refugee Malaysia website. You can cite as reference that the Ministry of Health has this provision that Hexacin is for free. So basically, when I say free, it means that you do not need to pay for registration or the vaccine. However, For all other vaccines like the MMR, the measles, mumps, and rubella vaccine, the pneumococcal vaccines, and others, you will have to pay. Usually the charges at government health facilities is registration is 40 ringgit and vaccine is another 40 ringgit. So all in all, you will have to pay 80 ringgit. But if you are a UNHCR document holder, then you'll be eligible for a 50% charge, which is at 40 ringgit. So which is half of the usual foreigners rate. Okay, so just make sure, I really want to make sure that all of you bring your child to get them fully vaccinated and protected, because we have seen quite a number of sporadic outbreaks of late, particularly among children on the measles within the Klang Valley itself. And I do know that there are also some outbreaks in other locations. So this is very important. You make sure that you protect your child from all these vaccine preventable diseases. Okay. Okay. Moving on, in case at all you or your peers or anybody that you know of will require inpatient care, hospitalization care, and but having difficulties like affordability, unable to pay for the fees and whatnot, then just to make you aware that we have a partner, which is a Malaysian Relief Agency, providing some case management and support for such a request. So what you can do is basically you can actually approach them through the hotline provided here. You can reach them through either email or the phone numbers provided here to get in touch and to make a request for medical assistance. Okay, so if you fall within the eligibility criteria, and they will inform you then that to proceed, that to share with them a clear medical memo with diagnosis and treatment plan, or your UNHCR ID, as well as other related documents, for example, your next appointment, etc., etc. So usually the caseworker will be there to advise you and on what is required, which you can provide. So do note that currently there are 3 caseworker only working with MRA on this case management. So I also understand that there's a very high number of requests coming their way on a daily basis. So do practice patience with them, and do cooperate with them as much as you can while you're making a referral. And if you have language difficulties, and I understand that they are only able to speak Malay and English, you might need to get help from within your community as to get someone to help you to interpret and to convey your concern to the caseworker. Okay. So once your case is being taken up by the caseworker, usually the assessment will be processed within a week. Okay, so they will actually look into your case and make a necessary assessment, and then they will make the submission to the health referral committee, which is a committee that is formed as an independent committee to review submissions made by the caseworker, and then determine whether this case will be approved to be supported or not. So and then eventually, once the caseworker receive approval from the health referral committee, then they will then issue a letter of intent or a guarantee letter to the hospital to inform the hospital that they agree, MRA agree to pay for the cost of hospitalization for this particular patient. Okay, as I mentioned, this assistance program is quite limited in nature. Currently, we are only able to support about 70, 80 cases per year for 2024, and as such, not all cases will be assisted. Of course, we understand that there are also other partners providing some support as well. For example, Doctors Without Borders, MSF. We also have partners like Refugees Emergency Fund, even some community organization do help with hospitalization support. In case you couldn't reach or your MRA is unable to help you, there are also other partners who potentially might be able to help some of these cases. Again, medical cost is quite expensive in Malaysia for refugees, and this can be a big challenge for many. So as much as possible, please make sure that you do have some emergency fund save up if you can, in case of such incident, or to reach out to some of these partners like MRA, MSF, and others in case you require some assistance. Okay. Moving on next, just to highlight also on this treatment for selected communicable diseases, as you understand that most of the time the refugees will require to pay for services at government health facilities, but specifically for these 9 diseases, these 9 infectious diseases, the Ministry of Health has waived the fees for anyone. So whether you have your UNHCR document or not, you'll be eligible for free treatment for these 9 conditions. Specifically, I think what we commonly see among refugees are TB and malaria currently. So these are the 2 illnesses that you might want to seek help, seek care fast, so that you receive the proper treatment. And most of the time, these treatments are free of charge. So basically, you get the full cost of treatment. And it's very important that you seek help early, so that to prevent the spread of these diseases to people around you and your loved one, and also to make sure that once you're on treatment, to follow the instruction provided by the health professionals, to make sure that you complete the course of the treatment. So for example, for TB first line, usually the treatment course is about 6 months long. Okay, it's for 6 months. So please make sure that you follow the instruction and complete the treatment course for 6 months. All right, so that's very important. But do note that I do understand that there are instances where, when some of you with symptoms presented yourself at the government health facilities for the first screening, there will be charges, which is true. So for unconfirmed diagnosis, the Ministry of Health do charge you for the initial screening, but upon diagnosis, meaning to say that they have confirmed that you have this condition, then they will waive the rest of the treatment. So the initial screening, you may have to pay for it, which is it could be somewhere around, depending on the type of test that they perform, it could be somewhere around 60 to 150 ringgit. Okay. Especially for HIV care, we have a partnership with MRA, Malaysian Relief Agency again, where MRA, through their caseworker, Aziza, they do provide treatment adherence support and monitoring. So basically, for someone living with HIV, you can actually seek assistance from Malaysian Relief Agency through Aziza for case management. And besides that, the UNHCR also provides some support for the treatment of HIV, which is for the medication, the antiretroviral medication. So we do look into helping refugees living with HIV to access treatment, which is very important to keep them healthy. HIV is no longer a disease that is not treatable. So it's highly treatable. Yes, there's no cure, but with the right treatment and good compliance to the treatment, anybody can live a very normal life, I would say. Okay, so you can be as healthy as anybody, and as long as you take your medication on properly, and make sure that you follow up with the doctors from time to time. So even then, I think on the follow-up, now is like last time, where you will need to go and see a doctor every other month. Nowadays, once you are stable on treatment, you are taking your medication properly, basically you only need to see the doctor like once a year. So if you suspect yourself like having risk of being exposed to HIV, do seek testing at any of the government health facilities, the cost of testing is around 50 ringgit. It's a confidential testing, basically meaning to say that they do not reveal your identity to anybody. They will do a pre-counseling before you perform the HIV test, and then the post-counseling, whether it's a negative result or a positive result, they will still provide some level of counseling to inform you what are the do's and the don'ts, the preventive measures you should be taking. And if you are found positive, then you will also be advised to continue to seek treatment to start on this antiretroviral medication. So this is when you can actually approach Aziza through the hotline given here to get case management support from her. Okay. And another infectious disease that is of interest that I would like to highlight today would be on hepatitis C. For hepatitis C, basically, since 2023 January, the government, which is the Ministry of Health, has decided to provide full supply of the direct-acting antiviral drugs, which is the DAA drugs, for hepatitis C treatment for free. So basically, you can actually, upon diagnosis, you can actually approach the government health facilities to obtain these DAA drugs. So this is actually a treatment course of over 3 months where you can actually fully recover from this hepatitis C. Okay, so the important thing is that for the registration, consultation, and the lab test required, unfortunately, these are still chargeable. So for any one appointment, it could range somewhere around 200 to 400 ringgit for the appointment. But the good thing about this hepatitis C treatment is that you do not need to, it's not a lifelong thing. So as soon as you follow through and you complete the treatment, basically you are good to go. So so this is another new provisions by the Ministry of Health. It used to be very expensive, where the medication is highly unaffordable for most people, but now we are very thankful that it's being provided for free for refugees, for UNHCR document holder. Okay, so I understand that you can also seek help from some of our partners, for example, like MSF, even I think Mercy Malaysia in Kajang, to help you to facilitate in the process to obtain these DAA drugs for free. So they do provide some support. You can approach some of them, and this is also another good intervention to control another infectious diseases in hepatitis C. Okay, I'm going to move on to another part of health services, which is on mental health services. So as you might be aware or you might not be aware, mental health do affect some of you to a certain extent. A lot of times, because of the conflict situation that you experience, you might experience some signs and symptoms of mental health disorder, like feeling sad, having sleepless night, etc., etc., that you might require you to seek some help from the mental health specialist. Currently, we have a few partners which is listed in the Refugee Malaysia website, who are providing specialized mental health services. So these include counseling, psychotherapy, and even referral to psychiatric care. But for psychiatric care is basically specialized care provided by a doctor, where usually it might involve the use of certain medication. So these are highly specialized services. But for counseling and psychotherapy, usually these are more available among our NGO partners, where you can actually seek help if needed. So you can actually approach the Refugee Malaysia website to get information about these partners, to get in touch with them, to make an appointment if you need to see them. But do note that currently, I think the number of service partners are quite limited, and they are quite overwhelming also. So please bear with us as we move towards strengthening, building capacity among some of you to help your peers to manage some of the day-to-day challenges and to address some of the mental health needs as well. So I'm going to stop here. So these are some of the things that the key health services that I would like to highlight to you. Of course, there are more to this, but I would like to just keep some of the time for Q&A, because I believe that there might be a lot of questions coming, especially on these health services. So that's it from me. Thank you.